So a lot of the children that we see that have vaginal discharge, we also want to check them for urinary tract infection. So we send the urine, and if it's negative, we send a rapid strep test. If that's negative too, then hygiene can also cause vaginal discharge.
Hello everyone, on today's episode of Pediatrics To-Go, we are going to be talking about vaginal discharge in children. Hello Dr. Sanusi, and welcome once again.
Hi Francisca. So the reason we're talking about vaginal discharge is because we are seeing it commonly nowadays. Now, vaginal discharge is common in little girls, and sometimes we're talking about girls between the ages, after potty training, between the ages of 2 and 13. And a lot of those vaginal discharges is... it could be a combination of things. And then you see vaginal discharge in girls because they have yeast overgrowth. Now, the other thing that can cause vaginal discharge that we're seeing a lot of recently and now is strep. When children come in, especially in the US, and they're complaining, oh, they have a lot of discharge, we check a strep throat and usually it comes back positive. If you don't have a high index of suspicion, you will not know. And these children will have, because remember, anytime we have an infection, just like hand, foot, and mouth, or strep, it travels out through the P area and it can get a hold of the cells in the groin area. Just like hand, foot, and mouth will cause a rash, yeast, bacteria like strep will cause an infection in the groin area, but it will show up as a vaginal discharge. So a lot of the children that we see that have vaginal discharge, we also want to check them for urinary tract infection. So we send the urine, and if it's negative, we send a rapid strep test. If that's negative too, then hygiene can also cause vaginal discharge. If your children are wiping the wrong way, especially when a girl has used the bathroom, she went to poop, and she put a little poop in the P area, that can cause itching and irritation, and vaginal discharges can occur after that. So most times we also want to rule out any kind of sexual activity or sexual abuse, because if a child is getting abused, they can end up with vaginal discharge. Once that is ruled out, then it's usually common infections like yeast infections or just your strep infections that can cause vaginal discharge. What is the treatment? If it's a strep infection that's causing it, we treat with antibiotics, preferably cephalexin, which is a cephalosporin, because that tends to work better with children who have vaginal discharge and strep in the throat. And then if it's a yeast infection, then we give topical antifungals like your clotrimazole or your nystatin creams, and that usually helps, especially if there's no urinary tract infection. If there is a urinary tract infection, the treatment is the same as the strep treatment, which is your cephalexin, and we give that. See your doctor so that they can check and make sure everything is fine. If there's a suspicion for sexually transmitted diseases, then based on your location, where you are, whether you're located in the US, there are guidelines in the US on what this STD test should be. Of course, we always check for gonorrhea and chlamydia. And then if you want to check for your HIV and your herpes and everything else, that's fine. But generally, when children show up with vaginal discharge, usually it's a simple question. It's a simple answer. It's either yeast infections, not cleaning well, or poor hygiene. If your child is cleaning the wrong way, please, moms and dads, show your children how to clean, especially if they've just potty trained. And then if it's a strep infection, we give antibiotics, and then for the yeast infection, we give antifungals, and that's really what it is. Anytime children have vaginal discharge, we also talk about hygiene for cleaning the bathtubs. You want to use bleach to clean the bathtubs, especially if the children are doing baths, and if you can put them in showers, even better than doing baths, because sometimes there's a lot of yeast in the water, and if your children are doing bubble baths or bathing in bathtubs are contaminated with a lot of yeast, then they could have the vaginal discharge, and that will cause a lot of discomfort and itching. So that's really the other thing. One more thing is just to minimize hotness and humidity in the diaper area. I call it diaper area or private area. We recommend most girls should sleep without underwear, and preferably sleep with boxer shorts or the big pajamas that are shorts instead of wearing underwear. And we also recommend that use wipes to clean when you use the bathroom, so that the private area of your daughters can be nice and clean and there's no recurrence of the vaginal discharge. And that's really what we have to talk about today.
All right. Thank you so much. Well, thank you so much. And thank you for watching. All right. See you guys next time. Bye.